Welcome to Skark Bite. Skark Bite is a product of Crown Enterprises. The Skark Bite is a 5-minute anterior programmer that is used to do three things. Number one, it relieves muscle trismus and pain. Number two, it helps diagnose the position and condition of the temporomandibular joint. What it does, it helps determine whether it's a disc or a muscle problem. Number three, it helps obtain and record centric relation, which is the treatment position of choice. Centric relation is the relationship of the mandible to the maxilla when properly aligned condyle disc assemblies are in the most superior position against the eminentia, respective of the tooth position or vertical dimension. In the following program, we'll demonstrate how to make a Skark Bite anterior programmer and then explain how to use it. First, place the tray against the maxillary arch, making sure it's flat against the occlusal plane. Pull the tray anterior until the protrusion on the tab touches the lingual surface of the two central incisors. This is where we want the tray placed after it's filled with blue mousse material. Remove the tray. Dry off the palate directly behind the maxillary incisors. Extrude the area full of blue mousse or any other similar bite registration material. Extrude a similar amount on the tray, making sure it's on the side of the protrusions. Place the loaded tray into the mouth against the occlusal surfaces of the maxillary teeth. Drag the tray anterior until the protrusions on the loaded side comes into contact with the maxillary central incisors. Also, be sure the midline of the central incisors coincides with the midline of the tray handle and the tab in the center of the tray. Hold in place for a minimum of 30 seconds. Remove both the tray and the material from the mouth as one unit. Using a scalpel or Bart Parker knife, trim off the excess on the posterior side of the tray. Now, trim off the remaining excess, cutting buccal cusp to buccal cusp, to incisal edge, and around the buccal cusp. Remove the excess from the tray. Cut the connection on the anterior part of the tray that connects the tab to the tray, and the same connection on the posterior part of the tray. This connection has some flesh, so be sure it's separated completely. Now separate the tray from the tab and the blue mousse material. Remove any sharp edges or excesses to make sure that it's comfortable for the patient. Cut off the excess tab which protrudes from the blue mousse material. Smooth all sharp edges by using a reshaped Berlou wheel from Brasler. Reshape the wheel by running it against a diamond disc or any sharp edge. Remove any excess dust. Place the Skark Bite back into the patient's mouth. Mark the right side as the patient clenches down as tight as possible. Do the same on the left side. The patient hitting on the left side. Relieve the areas that mark with a diamond wheel or carbide burr. Mark both sides again with the patient biting down with maximum force. Make sure the patient is in the most retrude position. The Skark Bite is now completed. Insert the Skark Bite into the patient's mouth. Now there are two ways to obtain centric relation. First, use the Dawson bilateral manipulation method. Gently romance the mandible back into centric relation. When you feel the condyle disc assemblies are in the most superior positions against the eminentia, have the patient close until the lower central incisors are against the tab on the Skark Bite, now located in the maxillary arch. Then, have the patient apply light pressure, making sure there is no tension or tenderness at either joint. If there is tension or tenderness, you may need to relax the jaw more. Repeat this procedure until the patient can clench down on the posterior teeth with maximum force, but don't bite forward. Although the front teeth will be the only place hitting, we want the maximum biting force on the posterior area, not the anterior teeth. When you can load and the patient can load and there isn't any tension or tenderness in either joint, then the patient is in centric. The second method is to use the Dawson bilateral manipulation method, and romance the jaw back into centric relation. Have the patient slide forward and back. Repeat forward and back on the tab on the Skark Bite. Then clench down for 6 seconds in the most retrude position. Let up for 6 seconds. Repeat clenching down 6 seconds. Let up 6 seconds. Again and again until there isn't any tension or tenderness in either joint. When we have no tension or tenderness in either and the patient is clenching down with maximum force, then we know the patient is in centric relation, the treatment position of choice for restorative dentistry and normal functioning. The Skark Bite will enable you to record centric relation. First, remove the blue mousse material that covers the surface of all premolars. Use a scalpel or barred Parker knife. Place the Skark Bite into the maxillary arch and dry the posterior teeth. Then cover the maxillary molars and premolars with blue mousse. By using the Dawson bilateral manipulation method, place the already deprogrammed jaw back into centric relation and have the patient clench down as hard as possible. If there is no sign of tension or tenderness in either joint, then they are in centric and must remain closed for at least 30 seconds. Remove the entire centric bite. Separate into 3 pieces and only use the portions covering the right and left molars and premolars. Do not use the Skark Bite when mounting cases in centric. Take a look at the following slides. If a pain-free mandibular joint can't be achieved, there's probably a disc problem, not a muscle problem, and this issue must be pursued further. This finishes the fabrication and use of Skark Bite. Skark Bite is a trademark product of Crown Enterprises. We hope this has been of use to you, and good luck in your journey to become a master dentist.